Starting off clinical cardiology with the star topic, and the star topic is pulse. A lot of us are still unclear with the concept of pulse. Pulse is a pressure wave and not the flow of blood. When you palpate your pulse, you are feeling the pressure wave and not the flow of blood through the artery. First, the definition of pulse. Pulse is defined under 4 points, and each of these points are significant for its definition. And these points are: pulse is a pressure wave which is palpated over peripheral artery against a bony prominence, which is produced or generated by the contraction of left ventricle or left ventricular systole. And then I'm going to give a tail to this star. So what is pulse? Pulse is a pressure wave palpated over peripheral artery against a bony prominence produced by the contraction or left ventricular systole. So how is pulse generated? It is generated by the contraction of left ventricle. So let's see that with the help of a diagram. This is your left atrium, this is the left ventricle, and this is your aorta. And if you know your cardiac cycle, you must know that during ventricular systole or during contraction of ventricle, the very first phase is isovolumetric contraction. In isovolumetric contraction, the valve in between the left ventricle and the aorta, which is the aortic valve, is closed. Since the aortic valve is closed, there is no communication between left ventricle and the aorta. As the left ventricle keeps on contracting, the pressure inside the ventricle becomes greater than the pressure inside the aorta. When the pressure inside the ventricle becomes greater than the pressure inside the aorta, the aortic valve opens completely. As soon as the aortic valve opens completely, now there is complete communication between the two systems of the heart, that is your left ventricle and the aorta. When two systems of the heart are in complete communication with one another, the pressure and volumetric changes in one system is faithfully transmitted to the other system. So I just mentioned 3 points, and these 3 points are actually 3 separate concepts that needs to be there in your head. So listen carefully. First, the left ventricle is contracting, but the pressure inside the left ventricle is less than the pressure inside the aorta, so the aortic valve remains closed. The left ventricle keeps on contracting. Eventually, a point comes when the pressure inside the left ventricle becomes greater than the pressure inside the aorta. At this point, the aortic valve opens. When the aortic valve opens completely, I repeat, completely, because there are pathological conditions like aortic stenosis where the valve does not open completely. Normally, valves, when they open completely. So when the aortic valve opens completely, now there is complete communication between the two systems of the heart. They are the left ventricle and the aorta. As a result, the pressure and volumetric changes in the left ventricle is faithfully transmitted to the aorta. And this is how. So as the left ventricle keeps on contracting, the pressure inside the left ventricle increases. This increment in pressure is faithfully transmitted to the aorta, that is inside aorta as well, the pressure increases by same extent. This increment in pressure brings about changes in the artery. What type of change? So the pressure, it applies perpendicular force against the wall of the artery. As a result, there is slight bulge on the wall. But then this pressure does not just stay there. This pressure from the aorta gets propagated throughout the arterial system along the wall of the artery. See, so I'm going to take an example. I'm going to take the example of the arterial system supplying your upper limb. So let's produce the aorta forward towards the upper limb. The aorta, when produced forward towards the upper limb, we get the brachiocephalic trunk, the subclavian artery, the axillary artery, the brachial artery, which bifurcates into ulnar artery, and the radial artery. The pressure change in the wall of the artery propagates forward like this. So now the bulge appears here. It further propagates forward, and then the bulge appears here. It further propagates forward till it reaches periphery. This propagating wave produced by the change in pressure in the artery manifested in the wall of the artery is your pressure wave. And the velocity at which this pressure wave is traveling is 5 meters per second. When the pressure wave generated by the contraction of the left ventricle traveling through the arterial system finally reaches the peripheral artery, you will be able to feel it with the tip of the finger like this. So you put the tip of the finger here. Due to the pressure wave, the wall of the artery bulges outside, and this wall strikes the tip of the finger. This is exactly the pulse that you are feeling. That while palpating, the pulse that you are feeling is actually the wall of the artery bulging outward due to the transmission of the pressure wave, which then strikes the tip of your finger. So the pressure wave is transmitting throughout the artery along the wall of the artery, which is causing the wall of the artery to bulge out, and at the periphery, when the wall of the artery bulges out, it hits the tip of the finger, and then you feel it in the form of pulse. And that is why pulse is pressure wave. Let me use an analogy. Let's say left ventricle is a generator, a pressure generator, which is connected to the arterial system, which I have shown here with the help of a compliant pipe. Now the pipe and the generator are in complete communication with one another. As a result, whenever the generator produces pressure, it gets faithfully transmitted to the pipe. This pressure travels through the pipe, propagates forward through the pipe along the wall of the pipe in the form of vibrations. This is exactly what is happening here. Here also the left ventricle is contracting, which is producing pressure. This pressure is then traveling throughout the arterial system along the wall of the arterial system in the form of pressure wave, and this pressure wave is causing bulging out of the artery wall, which you are feeling in the form of pulse. Now this is best felt against a bony prominence, because against a bony prominence the artery remains stable. And this is it. So what is pulse? Pulse is a pressure wave which is palpated over peripheral artery against a bony prominence produced by left ventricular systole. Another concept. So the velocity, see, when left ventricle is contracting, it is not just the pressure that is getting faithfully transmitted. The volume is also getting faithfully transmitted. Then where is this volume? Let's say this is the start line of a race. This race is between pressure wave and the volume of blood. So let me draw the volume of blood here. So this is the column of blood, or the volume of blood, the column of blood. And this is the start line for the race. The velocity at which the pressure wave is traveling or propagating is 5 meters per second. But the velocity at which the column of blood is traveling is 0.5 meters per second. That means when the left ventricle contracts, by the time the pressure wave reaches the peripheral artery, the blood is yet to come. The blood is behind, it's second in position. Pressure wave is there, but the blood has yet not arrived. Okay, so with that, hopefully you have understood the concept of pulse. I can't make it much more easier. Next up, assessment of pulse. You assess the following characteristics of pulse. You look at the rate of pulse, you look at the rhythm of pulse, you look at the volume of pulse, then you look at the character of pulse, then you look at the condition of the condition of vessel wall, you look at delay, whether there is radioradial or radiofemoral delay, and finally you palpate the peripheral pulses. Rate is best assessed over radial artery, rhythm is best assessed over radial artery, volume is best assessed over carotid artery, and character is best assessed over carotid artery. So remember, rate and rhythm, radial artery, rate, rhythm, radial artery, volume and character, carotid artery, volume and character, carotid artery. There are 4 exceptions in character which I'll tell you later. While assessing pulse, you always need to assess it for 1 whole minute, and here's why. What do we normally do? We go and assess pulse for 15 seconds. We count the number of pulse in 15 seconds, multiply it by 4, and that will give you pulse rate in 1 minute. But while doing so, you might miss out on the true rhythm of the pulse. For instance, let's say a patient has irregular pulse, but the irregularity of the pulse is only present at the last 15 seconds of 1 minute, let's say. Then if you palpate this pulse only for the first 15 seconds, the pulse will come out to be regular. But in fact, the irregularity is present at the last 15 seconds. So you will miss out on the irregular part of the pulse, and you will mistakenly or falsely interpret the pulse to be regular in rhythm. And that's going to be wrong. So you need to assess pulse for 1 whole minute.